Welcome back to BNC Live. From coast to coast, vaccine mandates are spreading, but so too are opponents of mandates. Experts agree mandates save lives, especially for immunocompromised, something CNN anchor John King pointed out in a personal revelation.
I'm going to share a secret I've never spoken before. I'm immunocompromised. I have multiple sclerosis. All right? So I'm grateful you're all vaccinated. I'm grateful my employer says all these amazing people who work on the floor who came in here for the last 18 months when we were doing this are vaccinated now that we have vaccines. I worry about bringing it home to my 10-year-old son who can't get a vaccine. I don't like the government telling me what to do. I don't like my boss telling me what to do. In this case, it's important.
King, of course, not the only notable person to be diagnosed with the illness. In fact, it affects our community. Joining us to discuss the issue is Dr. Bankole Johnson, a neuroscientist and chief medical officer of Adial Pharmaceuticals. Thank you for being with us.
Thank you for having me on your show. I look forward to chatting with you.
So first, just explain, what is MS?
Multiple sclerosis is a neurological disorder caused by basically the nerve cells losing their sheath. It causes a wide variety of symptoms, and it varies in severity from person to person. Some people may initially start with some muscle loss. Some people could also have extreme fatigue. There's a proneness to infections because there's an immunocompromised relationship with multiple sclerosis. It could lead to mental deficits. It's really not a good disease to have. It is chronic, and unfortunately, we don't have any good treatments to stop it completely. But we can actually improve the quality of life of individuals who have multiple sclerosis.
Describe how it weakens the immune system.
Well, a lot of the medicines that are used to fight multiple sclerosis, for example, steroids, which are one of the most powerful ways of combating multiple sclerosis, they actually suppress the immune system because they stop the immune cells basically from becoming activated. And if they are less activated, then there is a greater likelihood that an infection will take hold, especially a serious infection like COVID.
So in terms of our community, are Black and brown people more vulnerable to MS?
The data suggests that Black people may have a slightly greater amount of, if you like, frequency of multiple sclerosis, but I wouldn't spend too much time worrying about that. Multiple sclerosis is in all populations. It affects all racial and ethnic groups. And I think the most important message is that it is in our community, and it is something that we need to pay attention to, especially when we're trying to ask people to have vaccines to prevent the spread of COVID and to prevent the immunocompromised from getting even sicker.
You know, you look at someone like John King, and you would never know that he was dealing with anything like that behind the scenes. What are some of the symptoms or signs, and at what point in life are people typically diagnosed?
Well, first of all, I want to reach out to John and say he's a very brave man for facing the disease, and also for being brave enough to talk about it on air. Most people start off with weakness. They usually go to their doctor and complain of weakness. Either weakness in the limbs or inability to use their limbs properly. Some individuals can develop what are called shooting pains. They develop pains in different parts of their body that they can't, if you like, put a handle on. The other things that they may develop is they may develop some cognitive deficits, they may become forgetful, and eventually it affects all parts of the nervous system. It will affect the person's ability to read, to write, to walk, to function, and to basically take care of themselves. And therefore, it is a progressive disease, and it's very sad if anyone has multiple sclerosis.
But does it always progress to that level of severity, or are the medications and treatments that you're able to prescribe now slow it down to a point where it doesn't develop to that level?
Well, some people can have remissions. Some people have remissions of of several years from multiple sclerosis. And for those people, they're very lucky. For others, they may have a continuous progressive disease, and there isn't a way of actually getting rid of multiple sclerosis. We don't have a cure for multiple sclerosis. So in the end, it is progressive for everyone.
And so should people with MS get vaccinated?
People with multiple sclerosis should get vaccinated and should get a booster. As you know, people with multiple sclerosis should also avoid things that can lower their immunity. I mean, one of the things that lowers immunity is, for example, drinking alcohol, or drinking alcohol excessively would lower your immunity and make you more prone to being able to be affected by COVID, especially if you have multiple sclerosis. So looking after yourself, having a good nutrition, reducing your alcohol content, hopefully to close to zero or to safe levels, and to make sure that if you do have COVID, that you reach out to your doctor as soon as possible to be able to have your intervention or medical intervention happen very, very quickly.
We've been reporting on Colin Powell. You know, he died due to COVID complications because he had a compromised immune system with his cancer diagnosis. So is this a concern that MS patients should have?
Yes, Colin Powell, great man, and I was very sad to hear the news. It is a disease that, as you know, is progressive, and individuals with multiple sclerosis should definitely worry about getting COVID, and they should take extra precautions. In my view, if you have a disease like multiple sclerosis, it's important that you not only get double vaccinated, but that you also have the booster shot. Now, one of the misunderstandings that people have, and I've seen in the news, is people say, well, you know, he had a double dose of shots. Why did he get the infection? Well, the most important thing to understand is that no vaccine is 100% effective. The vaccines are at best 90% effective. So there is a 10% escape. And that seems like a small percentage, but when you consider it in a population, you know, if you can't, you know, think about 1,000 people, you know, 10% is 100 people. And so we have 350 million people in our country. So if we all got vaccinated, then, you know, you have an escape of 35 million people that are possibly likely to also get COVID. So the numbers become very large depending when you start to look at populations. So it's very important, not only do you have your vaccines, but you take precautions, you wear your mask, you try and exercise reasonable precautions in terms of social distancing, and you do all you can to be able to protect yourself and others.
Yes, still so important. Thank you so much for being with us this afternoon and for sharing your insight on this issue.